Live from Las Vegas, your only choice for live local news right now with Emmy Award winner John Huck, Olivia Fierro, and Weather 24/7 with Chief Meteorologist Ted Pretty. This is Fox 5 News at 10, local Las Vegas.
The battle against breast cancer is never easy for a patient. Treatment can be physically and emotionally draining.
But some new techniques being used here in Las Vegas for changing the way you can fight the disease. Fox 5's Rachel Moore joining us in studio now to share one survivor's story, talking about a treatment in particular that she feels really changed things.
Yeah, you know, this survivor calls herself a thriver, and she says that the new technique improved her outcome and her outlook.
Nobody wants to hear the C word.
Cancer. In February of last year, Carrie Marshall was diagnosed with breast cancer. She had a lumpectomy to remove the tumor, followed by radiation. After her first 2 therapy sessions, Carrie researched and found something she believed could help her through treatment.
I took a situation that is devastating at first and said, okay, what can I do? What can I do to make this okay?
Here at 21st Century Oncology, Dr. Brian Lewenda lies his patients on this table for radiation therapy. He uses these small transmitters to monitor the patient's breathing while using the deep inspiration breath-holding technique.
We have the patient take a deep breath in, and what happens there is it expands the chest, and the amount of lung that gets radiated is oftentimes less, and the amount of heart would also be less because the heart falls back out of our radiation field.
Those lines representing beams of radiation. For every radiation dose to the heart, risk of future complications like a heart attack increases by more than 7%. The deep breathing technique reduces transmission to the heart and lungs.
When she did do the deep inspiration technique, the amount of lung was reduced in terms of within the radiation field.
Carrie has been cancer-free for more than a year. She's a life coach for others going through radiation and chemotherapy, motivating others to take control of their lives and using experiences like this to learn from and overcome.
What it allowed me to do was become more engaged in my treatment, and so it was empowering for me to feel that I was doing something to help better the outcome of my treatment.
Carrie was Dr. Lewenda's first patient to use the technique. While each patient's treatment is different, the two say that this one was right for her and it could very well help others.
Well, and it's assisting with proven medical techniques, but I imagine that one of the hardest parts is feeling helpless, like something's happened to you and there's nothing that you can do about it. You just have to rely on all these doctors. And so it really makes a lot of sense to feel like you're part of the process.
Right. This way they really do feel like they are fighting the disease themselves.
All right. Rachel, thanks you.
Thanks, Rachel. Studies have found that the deep breathing techniques reduce doses of radiation to the lungs and heart by about 50%.